Hello, this is Dr. Gautam Banga, a consultant urologist and andrologist, Sunrise Hospital, New Delhi. Today I am going to discuss about prostate problem in our society. Prostate is a gland which is located just beneath the urinary bladder, and it encircles the initial part of the urethra, that is the urine tube, which actually delivers urine from urinary bladder to outside the body. Prostate is a benign gland which lies dormant in the body till the age of 30, and its main function is to secrete prostatic secretions which forms a part of the semen. But with the growing age, this gland is only found in male, and this gland start increasing from the age of 30 years, and its growth is variable, it's not fixed, like it varies from person to person and with the race and ethnic. Prostatic gland normally causes problem in the male of more than 50 years because the enlargement actually becomes significant in that age group. Prostatic gland can present with different kind of symptoms which is categorized into two forms, irritative or obstructive. In irritative symptoms, the patient can have frequency of urination, urgency, nocturia, that is getting up frequently in the night to pass urine, or it can present in obstructive symptoms like hesitancy, the patient needs lot of time to start the stream is poor, patient has to strain to pass urine, or there is complete retention of the urine. Prostate treatment can be categorized into three forms. The first is conservative watchful waiting, in which the patient has some prostatic symptom but he is comfortable carrying on its normal lifestyle and normal routine. So we tell the patient to keep a watch on the symptoms, and if the symptom worsen over time, we can put the patient for treatment, either medical or surgical, depending upon the limit kind of symptom he is having. In the medical management nowadays, there are a lot many drugs which are available in the market, and most of them are from one group, that is alpha blockers, and they act by reducing the tone of the prostate and thus help the patient to pass urine comfortably. These drugs are easily available, and it's the most preferred modality of treatment for prostate at the moment. These drugs are safe with minimum side effect, and the patient can consume these drugs for 6 to 7 years or even 10 years. If the patient have severe symptoms, or the patient has taken medical management but not got relieved, or his symptoms are worsening, then we normally advise the patient to go for surgical procedures. Surgical procedures are mainly in two groups. One is with laser and the other is without laser. With laser is known as HOLAP, or holmium enucleation of the prostate, and is the most commonly done procedure nowadays. In this 100-watt holmium laser is used, which is used to enucleate the whole prostate, and then the complete prostate is removed en masse. The other modality is without laser, that is TURP, which is still the gold standard and mostly done in small centers. It's safe surgery in which the electrocautery is used to cut the prostate into pieces, and those pieces are evacuated using an evacuation pump. Both the surgeries are good and they give good results, and the patient symptom resolves completely after the surgery. So the prostate patient the most important thing in prostate patient is to look for prostatic malignancy, because when the prostate enlarges, around 1 to 2% of people with a large prostate can have prostatic carcinoma in their prostate. So the most important thing is that every patient with a large prostate, or even every patient with age more than 50 years, should get their serum PSA, that is serum prostate specific antigen, done yearly. After 50 years, every yearly it should be done, and it has its own reference values, and accordingly the patient is decided whether the patient requires any prostatic biopsy to rule out the cancer or no. PSA is sensitive but not totally specific for prostatic cancer, and it should be checked by prostatic biopsy if the PSA is on a higher side. Prostate as such is not a malignant problem, it's a benign problem, and the treatment is very handy, and it's available in our hospital in all forms. Thank you.